So let's talk a little bit about the shifting gears on the actual transparency tool piece and some of the recommendations that came out of that work group, which by the way, I did participate on, the one that you mentioned that Marty Gaynor from Carnegie Mellon chaired. And, the first recommendation is that the state recommend that all insurers have a consumer-facing transparency tool. And I guess so, maybe starting first with kind of a philosophical question. Some might say the market might dictate sort of what's the best tool and what the best features are, and just kind of let the market kind of do its own thing, and ultimately employers or consumers will gravitate towards the insurers that have the best tools if in fact those are important to them. On the flip side, I think some of the conversation would say these tools can take a variety of different forms, and you need to make sure that they do certain things, otherwise they're not going to be so useful for consumers. So it really gets to that classic, sort of how much do you regulate versus how much do you let the market kind of dictate. And when it comes to sort of the specific elements of these tools, your thoughts on that topic?
Yeah, Marty Gaynor said to me, I'm not going to get the metaphor right, but in talking about the criticism in particular, that despite the fact that these tools are available, the utilization is low. He said, you can't teach a horse to drink until you bring them to the water, right? And the question is, are consumers not using them because they don't want to, because the market isn't demanding them, or are they not using them because they're not usable? They're not consumer friendly. They don't provide the information they really want. They don't provide it in a way that is actionable and usable to them. And I think when you look at these studies that show that half of people say they want more and better information of cost, that sounds like market demand to me. Now, maybe it's not bearing out in the number one thing they're calling their health insurer to yell about. I'm sure that's true. But that doesn't mean that there isn't a demand for that information, and particularly that demand is growing as we see an increase not only in how many health plans are using deductibles in the country, but how large those deductibles are in terms of dollars. And so my hope and my vision is that if we do a better job of making these tools something that delivers the information consumers want, they'll use them. Now, in terms of requiring them or not, policymakers and we want to know what works. And I'm not interested in mandating something if I don't know that it's going to have the effect and the impact that I want. And I think we have a lot of work to do in this space to really understand what works. And so I'm really still in the learning phase, in the phase of understanding. I think evaluating too, I think looking at the tools that companies have and saying, this one's better, this one has features that doesn't have. I think those are great things to be doing, and particularly if we can look at utilization, consumer experience within those tools, there's a lot to get there. But we have a long way to go to make this type of consumer engagement in the equation of cost around their care really valuable to the system.
I've often thought that, where is the shopping point? Because sometimes if you have a relationship with, say, a primary care physician, have some knee pain who refers you to a specialist, oftentimes those referrals stay within kind of the network or the system now that you have sort of selected your primary care physician. And so it's very easy for a consumer to get down the path where they're sort of in system, let's call it XYZ, and being referred to system XYZ, which lo and behold may have the higher price. And for a consumer to get to system ABC, which may offer the same thing for a lower price, that can be quite difficult for a patient to kind of navigate. So I struggle often with, the tool might tell you that one system's better than the other, but you're halfway down the tracks with this care relationship, with providers in one system. And I don't know if you have any thoughts on that, but in my mind, that's part of the complexity of making these tools workable helpful, because if at some point in a care relationship, patients can kind of get so far down a path it can become very difficult to make a switch.
Yeah, it's an interesting sort of two-part question to me. The first is a decision point really being presented as a decision point for the consumer? So when a primary care physician refers a patient to a specialist, that is a decision point for the patient. And sometimes that's how it's presented. This is the service you should get. There are many options. Here are some I recommend. Here are some I don't. Or here's a list. This actually recently happened to me. I was looking for a specialist services, and I got literally a list of providers in my network who offer that service with no information on cost, no information on quality. And when I called, they said, well, this one's the closest to your house on Google Maps. I said, but they're all within a 15-minute drive. So not only, first of all, that was good. At least they demonstrated to me that I had a choice and could be that actor in choosing between those providers. That's step one. Step two is then what is the basis of that decision? Now, one thing that came up, which gets to that first question of is it even being presented as a decision point, is that provider? And we talked a lot in the work group about whether we should and how we should engage providers in this conversation. And a lot of providers have discomfort with the idea of talking to their patients about cost. And, that's not my area of expertise, but at least working with the providers to ensure they are presenting the options, explaining to the patient that they have options. What are the resources they might look to help make that choice? And a recommendation is great. I have no concerns with that. But to your point, we don't want to have the patient's pathway through the system be a set of foregone conclusions. You came here, now you'll go there, then your labs will go there, your testing will be done here, and at no point is it presented as the choice that it really is.
Maybe along those same lines, I think what you just mentioned makes a lot of sense in terms of where that decision point is. And I'm wondering, some people also refer to the concept of shared decision making, or helping patients understand treatment options generally, as well as for a course of therapy needed for a given healthcare condition, but then also sort of the provider choice within that concept. Any thoughts on sort of the importance of this shared decision-making piece, or broader education around, do I need the joint replacement surgery? Do I need this sort of therapy that's being recommended? Is this prescription good for me? In addition to, if the answer to that is yes, where do I go for it? In the broader view of transparency, do you view that type of decision support as also important, or a little bit different?
Yeah, I mean, in many ways, you're leaving the core of my expertise as an insurance regulator, right? But we hear a lot in our healthcare system about unnecessary care being provided, excessive care being provided, and the cost that gives to the system. I think that's exactly why any of us in health policy are having these conversations about paying for value rather than paying for volume, and moving away from the fee-for-service structure, so that it is not only okay, but also supported by the system. And sure, it would be great if it were even more supported by the system, for the physician to engage in the question, not just of which care should you get, but do you need care to begin with?
Okay, so maybe last question I'll just ask is, this has been a great, conversation. Maybe I'd ask you to, think a little bit about the future, a crystal ball, as you sort of look into the future of healthcare and think about, where we may be 3-5 years down the road. What's your vision for Pennsylvania in terms of this topic, in terms of the type of information transparency that will be available for Pennsylvanians?
Yeah. And I'll broaden it a little bit to bring health literacy and health insurance literacy into the equation. I think our healthcare system and our health coverage system is in many ways a black box to the patients that need it and are trying to use it. And there are so many different pieces and different questions, and everything is really expensive. And that's a lot of burden to put on the consumer. And so we are really thinking about ways that we can support the patient, not only in structurally making coverage and care more accessible, more affordable, higher quality, all of those things that we achieve, but also that we're giving them the tools in their toolbox to navigate it in a way that they feel empowered to make the decisions they need to make and make them in an informed way. And so that means making sure people understand basic terminology, right? That we're explaining those things well. That physicians are engaged and helping their patients navigate these questions, and that we're making the information available that they need. And fundamentally, to me, that's cost, and it's also quality information in a more usable and tailored way. For example, you can often find quality information on a hospital in the Commonwealth. But can you find quality information on a specific surgeon? Maybe. How about that surgeon for a specific type of procedure? Probably not. Now, that's incredibly difficult from a measurement standpoint, and there are lots of challenges operationally to doing that. But that's also the information a consumer really wants. Is the person I'm putting my life in the hands of, often quite literally, the best qualified to do so? And so my vision is that we have made measurable progress in making information available to consumers that is not available today, hopefully both on the cost side and the quality side.
Great. Well, Commissioner Altman, I want to thank you for taking time today to talk about this topic, and really appreciate you sharing your knowledge on this and also plans for the Commonwealth. So thank you very much.